This is Michael Vanderpool, and today, as a journalist with the U.S. Press Corps, I attended by invitation Eastern Partnership Civil Society conference, actually, on the different practices and results of the COVID-19 disinformation response, question mark. And today is October 22nd, 2020, and this is based out of Brussels, but also Kiev, which actually the moderator was in Kiev, I believe, Minsk, Chisinau, Moldova, Tbilisi, which is my current location, but I'm an American citizen. Obviously, I'm with the U.S. Press Corps. Yerevan, which is the capital city of Armenia, and many thanks to Richard Giragosian once again for the years ago, back in 2015, invitation into the NATO Security Conference, Tbilisi, which was at the Holiday Inn, which I filmed Richard about 10 minutes of his presentation, and that conference title was on the Black Sea security topic. Hope Richard's doing okay. At the end of the conference today, they mentioned that Richard's electricity went off, and things are pretty stressful over in Armenia and Azerbaijan, and I wish the best to all of our friends over there. I have friends from both countries. In fact, I almost married a girl that was born and raised in Azerbaijan and dated a girl for at least 5 years who is Armenian, and in fact was friends, and we have a photograph with her and Richard together on the NATO Security Conference, as well as I and her between conferences at the NATO conference back on Holiday Inn there, here in Tbilisi. So the reason I'm making this video is because I want to give a little bit of a comment, and the comment is this on this topic of disinformation and the pandemic, the COVID-19 response. My family's been in the nursing care business for well over 30 years. That looks to be coming to a close perhaps as soon as this week. And so for a large part of my life, the last 16 years I've traveled expat style and tourist style, but especially expat style. I spent 13 months in Ukraine, lived and was there present during the Orange Revolution, which, as we know, was nothing compared to the very bloody, violent revolution there in Ukraine in 2014. But just to let anybody know who happens to be watching back on that doesn't know, but especially my audience that may be watching from America now or later, the Orange Revolution was basically a non-violent revolution, a soft color revolution they called it, in Kiev, Ukraine in 2004, 2005. And so I know a little bit about this part of the world because I'm in the country of Georgia while I'm live streaming right now, and have been for the duration of the pandemic start and before that. So about 16, 17 months here, and I would have already been back in the United States at least 2 times over by now. One of the delays was a family project related. The second delay, absolutely 100% the pandemic. Besides the fact that I stuck around to photograph one particular model again on photo session. But in general, my delay has been because of the pandemic, so I take it very seriously. And as I mentioned, the family background, I myself managed, I was an administrative assistant actually. I had a manager. So it was more than just, I was actually administrative assistant for Vanderpool Care Incorporated, a small nursing home or RCF level 1, residential care facility level 1. So I managed professionally medical care, medical specialist care, nursing care, and had an RN consultant come in, worked under the state of Missouri as licensed with both the Department of Mental Health on one side, and on the Division of Aging, was now called the Department of Health and Human Services for the seniors, on another side. Back then it was DOA for short. And in fact, I was a part of a pilot project, a pilot program for the state of Missouri for part of those years. and it was called the Fulton 55, so it was very small, and I had 3 residents in that program out of the entire state. So I have some background. I went to different colleges and education with this in mind, that I would be in the family business. So with the pandemic, naturally, my mother, being an LPN owner operator of an RCF level 1, know a little bit about the state, a little bit about governments, a little bit, but about state licensing and about hospitals, medical clinics, and nursing homes. In fact, what's happening with them inside and out to this very day. Here's why I'm making the video. It's to comment on disinformation. And first of all, I want to say that Gabriella's presentation and their creativity and what they're doing there in Moldova about teaching the youth, and I mean really teaching them, that's just incredible. I wish my country was doing the exact same thing, because her presentation was so spot on and so not only creative, and the approach, like in terms of social science, right? In terms of, research before, research after, testing before, testing after, to find out how they learned, if anything, and what was retained, and what was actually practically put into place by the youth there, and calling them super spreaders. That's exactly what we've known that scientists from Australia and Japan found out early on, is that the youth, the children especially, are the super spreaders of, asymptomatically of course, generally speaking, of the COVID-19. So when she said that, and the way they've gone about turning that around and really getting the youth to learn and understand and absorb and practice the information, is just phenomenal. I was really impressed with that. My country is in a I'm talking about the United States of America. They are in a crisis. They are in a talking about super spreaders. Let's talk about super misinformation. I want to say to some family members, and this is not speaking about my mother or my brother, and I have well enough sized family, okay, so I'll just keep the privacy and keep from going any further. But I speak to different people in my family and get a feel for, and friends too, in the United States, pretty frequently. Just like I'm doing this live stream, I can pick up the phone, so to speak, but it's actually a Skype or another service, and then I'll be speaking to family. So the thing that's scary is that I learned here in Georgia how easy it is to be in a situation where there's an event coming up, and it's on a big topic, and suddenly you've got certain people coming to you from maybe not necessarily the government, but they're close to everybody in several governments. They're coming to you. There's people from certain groups with certain agendas. They're coming to you with explosive information all at the same time, kind of a coordinated influence operation. And they're giving you information. And it's a very dangerous topic. And if somebody's giving you misinformation, it's dangerous because it can cause a lot of, well, it can risk warfare, technically. Or at best, it could push foreign policy in a direction that is based on false premises, more or less, at least maybe even halfway so. What the percentages are, I don't know. What I do know is it wasn't unusual for there to be a kind of coordinated, not attack, but a coordinated influence operation. And I got to understand that. So it looks to me like it's possible that that happens to, let's say, a family member that has huge influence. He's got 5,000 Facebook friends. He has been interviewed on radio, television, the air. So he's gotten information from people allegedly in certain key positions in the medical arena. Let's leave it at that. I'm not going to go any deeper with that out of respect to privacy for that. But I'm just aware that that happens. So that, and I'm thinking they probably don't even think that way over in my family. That there could be specific individuals that, for example, work in certain places, in medical places, that come and say the opposite of what's really going on, or indicators of things that will lead them to believe the exact opposite of what the truth is about the current situation with the pandemic in the United States. So that very same family member is downplaying the situation with airlines, with taking flights. In my case, it would be international flights, at least two, maybe three, but at minimum of two through four international airports on average to get back to Missouri. And as soon as I was given this information on one particular airline, I checked it online. I haven't been able to find that yet, but then I didn't go full, like full research mode. But the initial searches that I'd done, both on that airline's website and in the news source that I was told that it came from, I have yet to find that full information. What I did find was, for example, is that the airlines have lost billions of dollars. I'll just go ahead and say that it's Delta Airlines we're talking about here, that I'm talking about. The technology that I was told to look for that was allegedly reported on was something to the effect of what would be the cleaning of the airline itself. It didn't necessarily address the aerosol spread part of the pandemic. Although I was told that that technology that was reported on by a particular news agency I was not able to find that yet. Now, that doesn't mean that it's not there, sincerely, because I haven't done a full research into that. But what I saw was enough to know this. That airline lost so many billions of dollars, and they've already had to cancel flights, or did cancel flights, to 16 different cities. And that just tells me that people they're not flying. Or they're flying very little. A lot less people are flying. Because I understand the aerosol spread and the big, huge game of Russian roulette that it would be for me to fly. I mean, I'm 50 years old. I'm not 60 or 70, but the risk is still there. And furthermore, if I would fly home and pick it up, my understanding is that the incubation period for the infection from the pandemic can be at least 3 months, not the typical 14-day self-quarantine that's required. It can in fact I have seen scientific references to where they have found that out to be the case, that it can go up to, for example, 30 days or even 3 months in terms of a period of incubation. And so technically a quarantine to be fully effective would, in terms of self-isolation or quarantine in general, would have to be up to 3 months. Now, that's not going to be information that is counted on by some governments, because that might have come from scientists on a different side of the world that they don't recognize or don't trust or whatever, or maybe perhaps don't even know about officially. The very next day that I was encouraged about this technology on the Delta flights, for example, which I can't even fly Delta all the way back, I don't believe. Maybe, but I'm not sure. The very next day, I got information, solid information, that our local hospital in Marshall, Missouri, is now at capacity. They're overwhelmed with the intensive care units. I was told for 2 reasons. The flu, type B, flu epidemic. Secondly, because of COVID-19, active COVID. And I was told, for example, one patient at the local hospital in Saline County, Missouri, Marshall, Missouri, the patient had both the flu, type B, and COVID-19, but didn't have space to be moved into ICU, but needed to be moved into ICU, intensive care unit, but they cannot, because there's not enough beds. Later in the day or that night, I get an update from the Saline County Health Office online. Somebody passed it over. And I see a comment from a prominent nurse whose husband is an excellent physician in Marshall, Missouri. And her comment is something like, "I think we're headed in the right direction. But unless you know what I just told you, and unless you've seen my post on this exact topic, sharing this exact specific information on the overwhelmed hospital ICUs in Marshall, Missouri right now, you would be in a place of misinformation if you listen to another side of my family that doesn't know this information that I just shared, that has an opposite impression of the reality and what's really going on. Yet if that person or that person's close ones on that other side of my family, if they get ill, if they have an accident, if they have a need for emergency medical care, because they would end up, most likely, there's a chance them going to the same hospital with the same emergent care need. First of all, they're going to get exposure, most likely, because they do not have a hermetically sealed care unit or ICU beds for COVID patients. They don't have that. So the same air that is in the ICU that is exposed to the frontline medical workers, licensed U.S. medical doctors, physicians, medical specialists, nurses, medical staff workers, hospital workers, they're all being exposed to the same air. They're all sharing air. They're all sharing the same air. Now, in terms of the theory of viral load, the more exposure you get, I think we can see what's happening with frontline medical care workers around the world who are dealing hands-on with active COVID cases in intensive care units. There's an incredibly high increase of deaths due to COVID by medical doctors, frontline workers, nurses, frontline workers, and emergency care workers. And if they don't have a higher fatality rate, they are also, I'm seeing certain cases of where they have the long COVID. So in other words, like in one case, one person's been sick for 3 full months because the viral load. And another misconception is everyone's under this, where they are tricked. They are not, they're not well informed. They're not understanding. This is not the flu. The entire situation with the antibodies and the development of antibodies and the immunity and the seasonal nature of a typical coronavirus that perhaps hasn't been turned into a bioweapon, and hasn't been created in a lab and so on and so forth. Whether we want to consider those ideas as valid or still not proven, or maybe some people would even throw that in the realm of possible disinformation or not able to be confirmed as of yet, or whatever. What we can say, I think, safely as far as what is scientific, that it is nothing like the flu at all if you look at the actual statistical data. And that's the other issue, is the misinformation is so heavy that I can't deal with family and get the same perspective or the same approach on the pandemic. Because while one side is encouraging me to search news and factual information about the airline news piece that they saw, for example, and telling me about the misinformation, and that it's not as serious, that they've got this thing with the airlines, for example, new technology, and it's going to do this and that, and they're downplaying it. On the other side, I'm getting inside information, factual, solid, you can bet your bank on this, that not only is the pandemic real, and we know from mainstream U.S. news sources, television news sources, that in Wisconsin and in Utah, for example, Wisconsin, I think the ICUs were up to where they were like 20% capacity being overwhelmed or full, and I think in Utah, the top hospital in the largest area there were 3 ICU units in one hospital or something like that. They're already overwhelmed, they're already full. So it continues on. And then I get like I said, the inside personal not face to face, but over the phone, solid, no question, solid information that the ICUs in Marshall, Missouri, Saline County, overwhelmed. The patient has both flu type B, because there's a flu type B pandemic going on too, we are told. The patient that has both active COVID and type B flu couldn't be placed in an ICU, needs ICU, but can't be placed there in Marshall, Missouri. That's the situation that I can share with how bad the misinformation is in America. Because never before have I seen just so openly this type of clash of information. And it's so politicized there. The current administration, right, wrong, or indifferent, has put such an incredible spotlight on fake news or some less than honest major media organizations that it's so divisive within some population groups within the United States that if I mention a certain news channel, it is completely disregarded. It's black and white. It's become so divisive and so politicized, and there's such a hostility around it as well, that, and I'm seeing it on Facebook from American friends on Facebook, that if it's this news organization or if it's another news organization, depending on what they've been branded unofficially or maybe even officially in terms of their political orientation or ideology, then it is completely disregarded by one group or another group or another individual that has one political leaning or ideological leaning versus another. I've never seen this as strong or as prevalent in my 50 years, let's say my 30 years as fully adult, right? I've never seen it this intense and this hostile and this divisive. And I'm talking about this information on the pandemic. We're talking about if it's serious or not with these friends and family on the phone. We're talking about whether the measures should be, on the restrictions should be adhered to or not. Talking about topics like whether the economy should be put first over human lives. Yeah, rights and freedoms, and but not exactly understanding where emergency orders and executive orders and emergency medical law comes into the whole picture. So I didn't come on to talk very long about this. I just wanted to share outside of the last meeting that I was in, because it was a really good Zoom meeting. It was, and it's available now. You can go down on the Facebook and see where they, on the Eastern Partnership Civil Society Organization, you can actually see that. I believe it should be, I'm going to assume it was there because they had it running on their Facebook also. And so you should be able to go there. If not now, then I would assume later, and see exactly what I was seeing. And I tagged a couple of people from my hometown where I was born, and I lived until I was about 11 or 12 years old, before coming back and getting involved in the family nursing care business when I was returning from Central Missouri University, which back then was called Central Missouri State University, CMSU, to be involved in the topic I'm talking about right now, which is nursing care. It's really about medical care and nursing care, but it's especially about nursing care. When you're in an intensive care unit, that's when, if you get into a bad car wreck and you have problems with your, especially your cardiac or your breathing and things like that, you're going to go into an intensive care unit usually. And so it's an emergency care unit, really, and it's intensive care unit. And so when that's overwhelmed, the whole medical system is at risk. There's a lot more lives at risk than just people that have type B flu or COVID. There's cardiac, there's certain types of cancer, lung cancer, and so there's other types of emergency care situations that are now the entire medical system becomes at risk. This is why we talked about, and again, if you've got active COVID patients in your intensive care units in your local hospital, and you break an arm or a wrist and you need to go to the emergency room, maybe you're going to spend 4 hours there, 6 hours there, 8 hours there if you're in another type of accident or something, and you're in a hospital where you're all sharing the same air with active COVID patients where it's taken up maybe the entire unit or a good percentage, maybe 70% of the intensive care unit. You think that's intelligent? No, it's not intelligent. There should be a hermetically sealed separate care unit, actually a completely separate hospital or medical clinic separate that would give that kind of care, ICU, that type of care for COVID patients. We don't have that in Marshall, Missouri or Saline County. And there should also be, of course, the full hazmat, hermetically, not hazmat, but, hazmat suits with separate air respirators, that can be used several times under a chemical rinse or a chemical shower after each use, because that's really what the kind of biological, that we're dealing with this pandemic. So that our medical doctors, our medical specialists, our nurses, our emergency care workers, our emergency care staff, even a clinic or hospital, even the janitors, for example, no one should be exposed, especially their viral load. They shouldn't be, because it's showing in the number of frontline healthcare workers, medical doctors, nurses, etc., that are working so close, so frequently, for so many repeated shifts, hours, days. It's showing on the death count and death rate. So I'll stop with that. It's an excellent presentation, though, as far as what Gabriela Oljog, OJOG, shared from Moldova and what they're doing with games and educating the youth there, as what she used, excellent terminology, with super spreaders, because it is the youth, asymptomatic youth and children, that are the super spreaders of the pandemic, especially. And when you get them all together in a school or a university, and that is, grandparents are involved oftentimes with the family, and especially as part of the contact and so on and so forth, then it puts especially those people also at risk, as well as the entire family and the entire communities of which these super spreaders are a part of. So it was just an excellent presentation, but most especially in what they did and how they approached the process there in Moldova with teaching the youth on how to, and the children, on how to deal with the pandemic in a much more practical, fun, and effective and very creative way, as their tests both before and after implementing that project shows. So that's why I tagged in Bobby Joe Kraft in Marshall, Missouri, because we've had conversations on Facebook, comments here and there, in public, back and forth about this topic months ago, and I hope you'll find that informative. And again, you should be able to see the same presentation that I saw today, and if you want to move right to that, if your time restrictive, that's Gabriela's presentation on the Eastern Partnership Civil Society organization's topic today on the pandemic, which you'll find shared below this live stream. So that's what I have to share. The misinformation is so divisive and so incoherent in the United States among the citizens and among friends and family that it can be the difference between night and day. And it's just, you have to be really careful. If you don't have accurate, careful information, there are so many conspiracy theories, and if you're dealing with an influencer, if they're not careful, you can find that whether it's intentional or not, we are at times targets of coordinated misinformation or influence operations. I know this, I've seen it, I've experienced it. And the particular family member that I'm talking about, who I question now if he's been the target of a certain type of domestic influence operation. It's the very same situation that I've been, because the targeting was on exact specific timing by exact particular groups of people. It was well coordinated, and it was for a specific reason. I understand it. I'm not necessarily going to talk about it or reference that what it is right now. It's a completely different topic than today's discussion that I presented so far, and then one previous that I attended as far as that conference. But I know that it happens, and so it's kind of unfortunate because this type of information is being misused one way or another, and too often politicized, and very, very often too suppressed. Suppressed for economic reasons, for political reasons, or for profit reasons. Big money profit interests will certainly have certain agendas in misusing the information, one way perhaps or another. So, with that said, I'll share this and post. It's just something to be thinking about. What I do know is that, like I said, while on one side family was kind of optimistic about some information on airlines and the whole pandemic situation and the new technology on the airline that had to cut 16 flights previous and has lost billions of dollars. And I'm thinking, well, I bet they're coming up with some PR right now and some stories, PR stories, because they're going to lose everything they've got if they don't. True, right, wrong, or not. And secondly, on the other hand, solid, factual, 100% sure information that in the city that I was born and raised in until about the age of 11 or 12, their IC units are overwhelmed. Type B flu patient, COVID active, couldn't be placed in ICU. Then the same similar situations happening in the last few days as reported by major U.S. television national news networks in Wisconsin, Utah. Good luck finding out the truth, but I've given a little bit, at least on my local community today here, and it shows what I can contribute as far as sharing about factual information and a little bit about how coordinated influencing operations with questionable or misinformation being the target of those coordinated influence operations that I've experienced. Anyway, thanks to everyone today that put together excellent presentation, excellent meeting with the Eastern Partnership Civil Society Organization as a participant in the Zoom conference today. Thank you so much, and I hope Richard's electricity came back on, and the moderator from Ukraine did a great job, Moldovians, even the other presenter, and the whole panelist presentation was enlightening. And one last thing. I'm in Georgia. Georgians, they acted quickly. They acted first, along with Azerbaijan, in closing direct flights from China temporarily. In regards to the pandemic, they started to take action back about the first or second week of February, something which I happened to write about year and a half in advance on exactly that time would be a great risk. Not only the Georgia, but as far back as that December before, 2019, I wrote, and I quote, that the time between February 6th and mid-May would be not only one of the most dangerous times for this country of Georgia, possibly, but for an issue of regional security. Then came the pandemic. At least Azerbaijan and Georgia acted first, beyond and first, before the rest of Europe. And I had been invited to an Eastern European civil society organization conference before that time, and all I was going to be able to share with them for sure, with the partnership nations a part of that conference topic and participating as well, is exactly what I just told you I had already shared, which is that there's going to be some regional security issue, and I've already written about it, and or maybe I wrote about after that event that I was invited to. But in any case, I turned out to be 100% correct, and I hope the heads up helped leadership in this particular country, and maybe next door, talking about Azerbaijan, hope it helped them to move along a little quicker and keep their eyes a little bit more open and, boom, handle the emergency situation, which they've turned out to be one of the most successful. They're in the top of the few countries in the world that have been the most successful so far in handling the pandemic. So anyway, interesting, but that's something I'm rather good at, is telling when the weather can get kind of risky. Have a nice day. This is Michael Vanderpool, U.S. Press Corps journalist, also international freelance photographer, officially with U.S. Press Corps. Have a nice day. Coming at you from Tbilisi, the country of Georgia. Thanks again, everyone, for today's excellent conference, the Eastern Partnership Civil Society Organization. And again, check that out below. Check out their Facebook page. You should be able to see the share. I think that will be live and available for everyone to see, especially Bobby Joe Kraft and Tatiana. I've tagged you guys into it. It's well worth watching.